Hello everyone, my name is Sai Teja. I'm currently pursuing master degree in pharmacology and toxicology at Naipur Mohali. In this lecture, we will be discussing about basic concepts of pharmacology, that is pharmacokinetics. Let's begin. Now, what is pharmacokinetics? Before understanding what exactly, let's know about what is pharma. Pharma means drug, kinetics means movement. In the short form, we can say that what drug, what body does to the drug. It all tells about um, study of how drugs moves through the body over the time, including how they absorb, distributed, metabolized, and eliminated. When you consume a drug through orally, first it should absorb. What exactly absorption means from the site of administration to systemic circulation. From systemic circulation, that is blood, it should travel to tissue to show its therapeutic effect, and it should metabolize. Where it metabolizes, mostly it metabolizes in liver. In liver, if the drug is lipid soluble, it converts to water soluble. If a drug is inactive, it converts to active drug. If the drug is active, it converts to more active. So when lipid soluble is converted into water soluble, it can easily eliminated by body. Elimination is done by kidney. Most of the drugs are eliminated through kidney, and some of the drugs are eliminated by liver through sweat and also skin through the sweating. Skin eliminates drug, and also exhalation. Lungs eliminate drugs by exhalation. Now let's learn about what is pharmacodynamics. What is pharmacodynamics? It is a study of biological and physiological effects of the drug on the body. It involves interaction between a drug and its target sites, which can be a receptor or enzyme or any ion channels or other molecule targets. So before understanding the absorption, first you should know about routes of administration. Absorption is all about from site of administration to the um, systemic circulation. So what is you should know routes of administration. What is parental route? What is parental route? What exactly parental is? Parental is derived from the Greek word para. What is para mean? Para meaning that beside or beyond. And entron, what is entron refers to? Entron refers to intestine or gut. It refers to the fact that parenteral administration bypasses the intestine and delivers the drug or the substance directly to the bloodstream or the tissues. That is what we call parenteral route. What comes under parenteral route? IV, IM, SC, intravenous, intramuscular, subcutaneous, mucosal. In mucosal, transdermal, topical, inhalation, these are all are comes under parenteral. Whereas GI route, what comes under GI route? Rectal, oral, sublingual, this all comes under GI route, gastrointestinal route. So what is absorption? Absorption is, as we discussed, that from the site of drug administration to the systemic circulation, what we call absorption. For example, if you given a drug through orally, it should cross biological cell membrane and it should enters to the systemic circulation. When a drug is given IV, it is directly enters to the systemic circulation. Then we can say that there is no absorption. Why? Because it is not crossing biological membrane. Since it is not crossing biological membrane, we can say that no absorption, and there is no loss of bioavailability. The bioavailability of the drug is 100%. Let's look at the tail of pharmacokinetics. When we given a drug through intravascular drug administration, then there will be no absorption. It directly enters to the blood, and some of the drug it binds to the protein which is called inactive, and some of the drug which is unbounded, it is called active. The drugs which is not bound to the protein, it shows the therapeutic effect. It is distributed to the tissues. From tissues it shows the therapeutic effect, or if it binds prolonged time, it shows toxic effect. After showing therapeutic effect, it should be metabolized, and it should be excreted. After metabolism, it converts to water soluble, and it going to be excretion. The same thing happens with whether you are given through a intravascular or extravascular. But the difference is that in intravascular there is no absorption, whereas in extravascular there is absorption. So let's learn about routes of administration. The first route of administration is oral. Like most of the drugs are administered by orally. For example, aspirin, ibuprofen, paracetamol, and other many medications can be given orally. Oral medications are swallowed and enters the stomach and intestine. From there, they absorbed into the bloodstream and transport to the target tissue. The pros means advantage means it is convenient and slow, and uniform absorption will be there, and it is relatively safe, and it is the cheap. Whereas cons or disadvantage of this oral route is stomach. Some of the drug interact with the HCl and enzymes, and some might destroy. And irritable to the intestine, some of the drugs are irritable to the intestine, and drugs forms a complex with GA content. Sublingual. Normally, nitroglycerin is a example of the drug that is administered sublingually. The tablet is placed under the tongue and allowed to dissolve. This medications is then absorbed directly into the systemic circulation through passing mucous membrane in the mouth. By bypassing the digestive system, it directly enters into the systemic circulation. It is rapid absorption and escapes first pass metabolism and increases the bioavailability. But only a small amount is absorbed. Next route is rectal route. Rectal route, suppositories such as biscodile and glycerin are inserted to the rectum. When they dissolve when they dissolve and absorb into the bloodstream through rectal mucosa, this route is oftenly used when they are when the patient is vomiting or unconscious. This is having less first pass metabolism, and it is it is altered when oral route is not feasible to the patient. Like the if the patient is unconscious or vomiting, we prefer we mostly go through a rectal route. The cons of this rectal route is irregular and incomplete absorption. Now let's learn about intravenous. It is a direct and fast, and it escapes first pass metabolism. It is good for larger volumes and increases the bioavailability. 100% bioavailability will be there, and it is not soluble for the oily suspension. If the concentration is increasing the side effects. Now subcutaneous, as you know that insulin is the common medication that administered to subcutaneously. The medication is injected beneath the skin, where it is slowly absorbed into the bloodstream. This route is often used for medication that required for sustained release over the time. Relatively fast absorption, it is good for suspension and the pellets, but the cons are only small amount is given, which is painful. Now let's learn about transdermal. There is a drug called fentanyl. Is a powerful pain medication that can be administered through a transdermal patches. This medication is absorbed through a skin and delivered directly to the bloodstream, providing a sustained release over the time. But disadvantage is that it shows irritations, it causes irritation. Intramuscular vaccines such as flu shot are often administered, administered intramuscularly. This is the direct and fast absorption. And it is the cancer painful and may injure nerves. Inhalation. In inhalation, for example, albuterol is a example of medication that can be inhaled. This medication is directly delivered directly to the lungs where it reaches to the target sites. This route used for the medication that needed delivery directly to the respiratory system. So as you know that extravascular, in extravascular less than 100% of bioavailability is will be there, not 100%, less than 100%. When of the drug reaches to systemic circulation, the bioavailability is 100%. What actually bioavailability is? Bioavailability is relative amount of drug that reaches to systemic circulation. Relative amount, it would be fraction or percentage. What is the fraction or relative amount of that drug that is reaching to systemic circulation? What we call bioavailability. Let's understand more deeply. Before understanding bioavailability, we should know what exactly first pass metabolism. When you take a drug through orally, it reaches to stomach. From stomach, it reaches to small intestine. From small intestine, through portal circulation, it reaches to liver. Through portal circulation, through portal vein, it reaches to liver. From the liver, for example, X amount is metabolized. It is metabolized by the enzymes called cytochrome 4 P450. It metabolizes drugs. Some of the drug is metabolized by liver and rest of them is reaches to systemic circulation. For example, X amount is metabolized and remainder it reaches to systemic circulation. 1 minus X, this is what we call first pass metabolism. Simply, before drug reaches to systemic circulation, uh, some of the drug is destroyed by like metabolized by liver or stomach or small intestine. That is what we call first pass metabolism. So bioavailability of oral drug depends upon degree of disintegration of particular drug formula. Why? As we studied that bioavailability of oral drug depends upon disintegration of particular drug. But why? First understand bioavailability. Bioavailability refers to amount of the drug that enters to systemic circulation, that is like available to produce therapeutic effect. The bioavailability of the oral drug depends upon uh, several factors including disintegration of drug formulation. But before understanding, let's understand what is disintegration. Disintegration is a process by which a solid dosage form breaks into small pieces in the presence of biological fluids. Once a drug has disintegrated, it can be dissolved in gastrointestinal fluid and then absorbed into the systemic circulation. If a drug formulation does not disintegrate properly, the drug may not dissolve in GIT fluids, resulting in reduced bioavailability. That's why disintegration of drug plays crucial role. Therefore, disintegration of drug formulation is a crucial in determining bioavailability, ultimately the efficacy of the drug also. So let's understand what is bioavailability formula. This is when you given IV. This is plasma concentration, and x-axis here we taken time time versus plasma concentration. When we given through IV, it reaches to maximum concentration in the blood. Slowly it decreases, it distributes, and slowly it metabolizes, and slowly it excretes. This is the area under the curve. This is what we call area under the curve. By dose of how much dose, for example 100 mg, by area under curve by 100 mg. This is what we call, and divided by AUC by IV. This is IV, this is oral. Oral divided by IV. IV is standard one. Oral that divided by IV, that is what we call bioavailability. AUC means area under the curve. Area under the curve. Area under the curve. This is oral area under the curve. This is IV area under the curve. You can see that in the diagram, and it should multiply it by 100. Then you will get the answer. Now let's learn the terms bioequivalence also. If two formulations, a capsule or pill of the same drug, that have a same bioavailability and same rate of absorption, we can say that they are bioequivalent. For example, can I say that capsule and this pill or tablet having bioequivalent? What what they must follow if they are bioequivalent? They must have same Tmax, same Cmax, and same AUC, area under curve. What is Tmax? What is Cmax? Let's understand this. Give me a moment, I will tell you. For example, drug X has a two formulation, capsule and pill. Both are having bioavailability of 50% and rate of absorption is 20 mg per hour. Both capsule and pill are having same bioavailability and same rate of the absorption. Then we can say that both these drugs, capsule and pill, are bioequivalent. Now let's understand the term Tmax, Cmax, and AUC. Before understanding Cmax and Tmax, let's understand this graph. This is plasma concentration, this is time. Cmax is the maximum concentration of the drug in the plasma. See, when you given through orally, it is slowly absorbed. The rate of absorption is slow, but it reaches to maximum point where it reaches to blood. This is the maximum concentration of the drug in the plasma, and slowly it distributes, and slowly it metabolizes. Cmax is directly proportional to drug dose administration. More the drug you administer, more it will be the Cmax, like plasma concentration of the drug. Whereas Tmax, it is inversely proportional to rate of absorption. If the rate of absorption is more, and less will be the Tmax, it is reverse. What exactly Tmax? The time at which the time at which it reaches to, like, it just corresponds to Cmax. So this is the Cmax and Tmax. We can see the both of the definitions in next slide. We can see that this is the Cmax and this is the time. In y-axis we have taken plasma concentration. In x-axis it is the time. What is Tmax? We previously discussed that the time it takes for a drug to reach maximum concentration. How much time it takes to reach the maximum concentration, that is what we call Tmax. For example, this is the oral medication, this is both are oral medication. For example, consider this is the rapid formulation and this is slow formulation. When you take rapid formulation, for example capsule, take an example, for example capsule, see this, the rate of absorption is high, but here see the rate of absorption of the drug, it is slow. Then we can say that uh, Cmax is high for rapid oral rapid release formulation when compared to slow release formulation. Tmax Tmax is low for slow release, like Tmax is higher for slow release formulation. So higher the rate of absorption, higher the Cmax, and lower the Tmax. Lower the rate of absorption, here there is a lower rate of the absorption, but it decreases the Cmax, whereas Tmax increases. Tmax means the time it takes for drug to reach maximum concentration after administration of drug. Okay. So what are the factors affecting drug absorption? We can see that solubility, concentration, blood flow, surface area, contact time, pH. These are the factors that affects the um, drug absorption. First we will see solubility. Solubility refers to ability of a drug to dissolve in a solvent such as water or gastric fluids. A drug that is more soluble will dissolve faster and more completely, which can increase the bioavailability and improves its absorption. Now concentration. Concentration means concentration of the drug at the site of the absorption can also affect the absorption. Generally, higher the concentration of the drug will result in more rapid absorption, as there is a greater driving force for the drug to cross the cell membrane into the bloodstream. Third one is blood flow. As we know that blood flow to the site of absorption can also influence the drug absorption. For example, if you increase the blood flow can result to faster rate of the absorption as the drug deliver more quickly. In contrast, if you decrease the blood flow, there will be slow in rate of absorption and reduces the bioavailability of the drug. Surface area, as we know that surface area is available for the drug absorption, can also impact drug absorption. A larger surface area will allow more contact between drug and surface absorbing surface, which can increase rate of absorption. For example, small intestine. Small intestine has large surface area due to villi, which enhances absorption. Contact time. Contact time is the amount of the drug spends in contact with absorbing surface, which can also affect the absorption. For example, in a diarrhea case, the drug may not stays for longer time, then there will be less absorption. If a if a drug has a longer contact time, can increase in the rate and extent of the absorption, while a shorter contact can reduce the absorption. pH of a drug, sorry, pH of the medium, pK of the drug influences the solubility, influences the drug state.